Let's talk about obsessive-compulsive disorder. When are people too obsessive and too compulsive, and what is the disorder?
Well, obsessive-compulsive disorder is a very specific type of anxiety disorder, and it's characterized by people that have obsessions. Those are repetitive thoughts that they cannot seem to stop, or a compulsion, a behavior they can't stop. A couple of good examples of obsessive-compulsive disorder would be the hand washers. And these are people that are not hygienic. They're washing their hands 50, 100 times a day. They're spending a large part of their day washing their hands. Another is the checker. This is a person that checks their doorknob 15 times before they go to bed, and then they lay in bed worrying if the door is locked. And you can see how much time is spent doing these obsessions and compulsions.
Well, you can understand how that would be a huge problem, because I think we all say now, I wonder if I turned off the stove or the coffee, or if I did lock the door. So what's the difference between it's the number of times you do it and you're obsessive with it?
Right. It's not the act itself that's unusual. It's the amount of time and the amount of effort that's put into it. And almost always, people with obsessive compulsive disorder, they recognize this is excessive. Other people don't do this. And almost always they tell me, I wish I could stop, but I can't.
How do you guide them towards stopping? What do you do to help the patient?
Again, the same answer as before, and I'm going to sound like a broken record. It's a combination of pharmacology and psychotherapy.
So you talk to the patient, you let them understand what's going on, and then, if appropriate, you give them medications.
Yes.
Are there good medications for panic disorders and obsessive compulsive?
Yes, and interestingly, up until about 1987, we didn't really have any medications for obsessive compulsive disorder. We didn't have things that worked very well. And the drug Prozac was discovered in 1987. And from then on, we started having medications that were very effective for that.
That must be wonderful to suddenly have medicines that you can prescribe that will help. Does that make you lazy and say, oh, here, just take these medicines, or you still understand it's important to talk to the patient?
Well, you have to keep it in mind to talk to folks and help them understand. And the psychotherapy, the talking therapy, helps people understand what's happening to them and helps them change the way they think and the way they deal with their anxiety disorders.